Good afternoon, and welcome to an academic medical center's journey to the cloud, a complimentary webinar from HealthSystemCIO.com, sponsored by Iron Mountain. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of HealthSystemCIO.com, and I'll be your moderator today. We encourage asking questions. You can do that at any time. Type them into the lower right-hand corner of your screen in the Q&A box and leave the default set to all panelists. And I'll be looking at those and we'll be posing them later in the program. You can download the deck using the URL on your screen. I also sent it out in the chat box, and there's a shortened URL on each slide. And we will have an archive available of today's event, usually within 2 business days, and you'll get an email when it's ready, and a separate registration is required. We're going to go about 45 minutes today. First, we're going to hear from our featured speaker, Jaime Parent, Associate CIO at Rush University Medical Center. Then we're going to hear from our sponsor, represented by Michael Leonard, Director of Product Management, Healthcare IT with Iron Mountain. And then we're going to have our Q&A. So without further delay, I'm going to turn it over to Jaime Parent. Jaime, thanks for joining us.
Thank you, Anthony. And before I get started, many thanks to Anthony and Kate from HealthSystemCIO.com for sponsoring these things. I think it's a good forum and good conversation and really some good questions that they help put together for this forum. So I appreciate, Anthony and Kate, the opportunity that you've given me today to speak about our journey to the cloud. Also want to thank Mike from Iron Mountain. I mean, these things don't happen without a sponsor. And folks from Iron Mountain, particularly you, Mike, I really thank you for sponsoring this event and actually contributing to the value add that HealthSystemCIO.com provides. So today's discussion is going to be an academic medical center's journey to the cloud, and I will speak in general terms first, but then I really want to get into the Rush experience because that's a bit unique for our organization, and I think it gives you more insight as to what the cloud effects are on an academic medical center in the Midwest, Chicago, and how we've used the cloud, or in some cases maybe how we have not used the cloud to solve some of the business challenges that we have. So we'll briefly go into the what is the cloud, because I think a couple of years ago the cloud was a little bit amorphous than it is right now. I think we've got some more clarity on the cloud, but I still think in terms of what is the cloud, we need to baseline some definitions. So we'll do that, and we'll do a little bit of a journey as to how we got to this point. I mean, clouds used to be something in the air, right? Now they're a place where we store data, and we actually do a lot of business both from the personal consumer side as well as the business. And where is the cloud going? Where do we see, 3 to 5 years from now, what is the cloud and where is it going? And is it just another fad like maybe some of the other things, or does it really have solid business value for organizations, whether they're in an academic medical center or even in the commercial space? And then finally, like I said, we'll talk a little bit about the Rush experience and some of the unique things that we did with the cloud and some of the things we have planned going forward. So I don't know about you, but I like Wikipedia a lot. It kind of replaced the networking for dummies kind of book, but it's really so complete, and not only that, but it helps explain things in reasonable language. So this is directly from Wikipedia, and basically what you have here is just kind of the smorgasbord of pretty much all elements that we really do as part of our businesses or a part of our healthcare delivery as well. So we've got monitoring, we've got content, collaboration, I mean, you name it. The cloud has really evolved into not only a repository, but also collaborative, backup, security and protection in private clouds, the ability to work more collaboratively in public clouds, hybrid clouds. So really, I think the cloud is here to stay. And I wouldn't have said that 4 years ago, simply because I don't think the cloud was as well defined as it is today. But now that I think we've got a common communication platform and common terms and a little bit of experience, we all kind of, I think, have a better idea of what the capabilities of the cloud are, and how how we can leverage those capabilities, yet keeping ourselves protected at the same time. So if you look at the cloud ecosystem, there's all different kinds of clouds. So you have your enterprise, and you have your private clouds, but you also perhaps have a virtual private cloud and maybe a public cloud. So the public cloud would be perhaps used for types of transactions or things where certainly they're not going to be intellectual property or personal health information or HIPAA guarded information. So you have just a number of different clouds in your ecosystem, and still everybody's going to define these clouds slightly different based upon your business. But I think the important thing is, what is the appropriate cloud for you to conduct your business not only profitably but also safely and securely? And how can you leverage perhaps some of the sharing tools that the cloud provides in order to enable perhaps a better work center experience, more rapid response to things like backup, and now we're seeing companies move to disaster recovery as well. So really the focus of this slide is to just kind of describe the ecosystem, but also remember that it's important for you to identify how cloud technology can really fit into your business. And I would caution you as to saying, okay, well, gee, everybody's going to the cloud. I need to go to the cloud as well. You can't go to the cloud unless you have a huge cultural shift, perhaps, in your organization. And we'll get to that when we talk about the Rush experience. So I try to simplify this as well in terms of public cloud and private cloud. So I won't read through these bullets because you can do that. But again, weigh your options in terms of what cloud is right for you and what is a business fit. And if you're like me, you're probably bombarded with a number of different companies that provide the cloud solution. It's similar back in the day when we talked about other types of infrastructure that perhaps have maybe come and gone. They were bleeding edge, but then they really didn't gain any ground. Public and private clouds are quite pervasive right now, but we still have that cultural aspect of, is my information secure in the cloud? And quite honestly, even for regular users, they often think that they could go to your data center and touch devices that have a particular application or data on it, when in fact that data may be spread across a number of different platforms or even a number of different data centers. So the operative theme here is, don't let the cloud define you. You define the cloud and see if you have a good business need or a healthcare need or something that helps you enable and empower, and not just jumping for the cloud for the sake of feeling that you're being left behind. All right, so here's a little journey, and for some of you who are perhaps old as I am, these will look very familiar to you. Everybody now, 2010 beyond, is pushing services. And for those of you that work a lot with vendors, it seems like everybody is now providing some type of service, whether it's web-enabled or whether it's going into consulting. I mean, you see actually services out there from companies that really are jumping into services, perhaps like cloud, yet they too don't have a strategic direction. They're just probably, my guess is they're adjusting to somebody higher up in the chain says, well, I read an article in a magazine, and, we ought to be doing this. Again, it's not technology that drives success. It's the workflow and business operations that help technology drive success. So be careful when you're approached by any vendor, and do your homework as to what experiences do they have in the cloud versus, what experiences they say is, well, we're just moving to the cloud. Because in the reality, it's still your data, no matter where it's at, and you have to have confidence that your partner, which is what I like to call vendors, the partner is actually working well for you in the services that they provide. Now, this is my favorite slide. I don't have a lot of slides here, and I'm not going to read them to you. You can read them yourself. But the embarrassing quote that's tied to Larry Ellison is, the cloud is gibberish, and, when is this idiocy going to stop? Well, Larry can't be all that bad, right? He's a pretty successful guy. But at the time in September 2008, and I understand he's got a different view right now, that's his quote just represents, I think, the feeling of many people. And because he is who he is, he just got to put on paper. But I think a lot of people at that time had the same view, and that's why, in terms of this quote, I was sure to put September 2008, not to pick on Mr. Ellison, but just to show that I think a lot of people had that view of the cloud in 2008, and why not? The cloud wasn't as well defined as it is today. And then you see the quote from Daryl Plummer. You see, again, this to me is like commercialism is really driving business. So for those of us in the academic medical environment, you're very familiar with the BYOD acronym, which is Bring Your Own Device. So Bring Your Own Device means that you now have to protect all types of end-user endpoints, whether you have direct control over them or not. So the game has really changed in terms of your security approach, because the bottom line is we're in a mobile environment, and that's not really going to change. We are virtualizing desktops and getting rid of PCs simply because the services that were not available then, and a few years ago, are now readily available, and in fact faster than the PC that a user has underneath their desk. And this is a good quote here, Amazon's official response to hosting for the CIA. So kind of like if you read that, when I read that, it's like, if the CIA, if Amazon's good enough for the CIA, well then they're probably pretty good. But I wouldn't just single out Amazon here. There are a number of providers, I think, that have the same type of security response and partnership capability that Amazon does. So I just use that as kind of reinforcing the notion that the cloud is something that is strongly protected, even though if you read any of the press clippings and you look at the hacker activity, you realize that the only real safe computer is probably the one that's turned off. But that's not the way we operate anymore. So I think cloud computing has matured so that a senior part of the federal government is now using it. And then the benefits may be clear, but deciding on when and where, how to put a cloud strategy in place is still a big challenge. And that goes back to the business or the medical center, healthcare institution itself. Going for the sake of the cloud is not really doing. You have to describe and you have to articulate and integrate how a cloud strategy works with your overall strategy for your organization. It's not how we tailor our strategic vision, our mission, vision, values to the cloud. It's how we have the cloud enable some of our mission, vision, and long-term planning, 3 to 5 year or however long you go out. The cloud is just another tool at the end of the day. And tools have to be evaluated and assessed for their applicability to the work center. And so that's what I would say is do your homework on the cloud strategy, look at it in terms of your overall framework strategy for your organization, and then make the right business decision as to how you can use the cloud most effectively in your environment. So I have some kind of shout-outs individual for vendors, because we have all types on the call, and I want to be respectful and give advice to both sides of the fence, whether you're a vendor, partner, service level agreement, or a customer. So the vendors, my advice would be for this: do your homework, because you really have to understand the needs of the business and the customer that you're talking about. If you just go in there and talk about generic cloud capabilities and don't help the customer try to figure out how this could be integrated, you're probably not going to get the sales, simply because customers, I think, like to know that their vendors know about their business. Certainly not everything about it, but, do your homework. Look at the website. Look at whatever information is available about that site, and really get to know your customer. And do you know how to target an organization? I get people that get emails from somebody, and it's from a cloud provider, and they say, here, I thought this might be useful. So that's kind of the cold call in digital age, the cold email. Know who the right person is in the organization, and I think vendors do that well already, simply because their time is valuable as well, and they don't want to waste anybody's time, and they don't want to waste their own time as well. And can you align your services with the IT strategy? I think this is a key point, because oftentimes customers might need help in maybe articulating what their IT strategy is. And the thing you want to push is not so much, here's the cloud, it's great for you, but customer, I understand your challenges. I've seen challenges like this in other environments, and I think we really have specific tools that can help you not only meet those challenges, but exceed expectations not only for you and for your customers. I think that's the kind of approach that, at least that's what I like to hear. And then, well, I've kind of turned the term low-hanging fruit, which I really hate, but sometimes I use. So now I just call it, can you align no-brainers? What are some things easily that the cloud can do that perhaps don't involve a great amount of risk for an organization? So, I mean, you could come in and scare the daylights out of people by talking about, the recent breach of 4 million medical records or whatever, or what happened to other systems. But maybe there's some utility in storage. Maybe virtual storage in the cloud can help save costs for your customer. So try to align some low-hanging fruit, or no-brainers that can make it a win-win for both of you. And then you've got to demonstrate that you're in for the long haul. Because like I said, everybody seems to be climbing on the services train, and some people are climbing it from a sell perspective, and they don't even know they're going with the cloud. They just know that they have to offer something, and they too don't have a strategy. So you got to demonstrate that you're in this for the long haul, and that you're not going to go by the wayside of perhaps the way client server went. You want a rock solid approach as well as your customer, so that you're a partnership for the long haul. All right, so on the customer side, how to win with a cloud vendor. First of all, you have to be talking the same language. So you have to agree on common definitions and terminology. So ask your vendor, what is your view of the cloud? What different types of clouds do you have? And maybe we can get some common ground as to how that particular cloud or environment could help me with my workflow or my business. So, maybe I don't have a good disaster recovery program here because it's too expensive. Well, maybe I could do DR in the cloud. Or, I have a lot of storage concerns, and, storage is kind of expensive, and I don't have money to put into the infrastructure. Well, maybe the cloud would be a good fit for you there. Or, I'm installing new technology, and is that technology better served by cloud services, or should I make the investment to keep it, on-premise, if you will? So kind of look at those customer needs and your capabilities, seeking joint opportunities for success. I know that there's a lot of people that you sell, I buy. That's not the way I operate. I fully appreciate what vendors have to do, and we're in this together. So that means if you have a problem, I can help you, maybe with that, a presentation or something or whatever, and then you can go the extra mile when I need something. So look at that as a value add to your customer, and perhaps, in a way that the customer doesn't expect, but you've delivered. And partner together and win-win, and make sure the cloud computing is good for both. Because if it's good for one and not so good for the other, that relationship isn't going to grow and mature. My questions for CIOs or IT directors out on the call. First of all, do you have a cloud strategy? And that might be an insulting question to some, but then again, it might be, we think we have a strategy, but, I know we got to put stuff in the cloud, but, I haven't really thought what works for my business or my healthcare institution. So it's important to have a cloud strategy and try to figure out how you can use cloud technology to make your organization more efficient or even save some money at the same time. And how does your organization manage risk? Traditionally, healthcare operations are very risk-averse, and there's a lot to be said about other institutions as well. So how you manage your risk is going to go a long way into how you manage a dive, if you will, into cloud computing. Is it really worth the risk of doing so? Do we have a good partnership? Do we know where we're going with cloud technology? These are the types of things that are really risk-centric, and you need to decide those on your own even before you get visited by anybody. And are you willing to listen to a solid ROI proposition? We get cold calls, we get cold emails, but you have to be open-minded. And I think if you're open-minded, everybody talks about people being innovative. I think the first step at being innovative is just being open-minded. So talk to people when you go to your vendor events. Talk to people when you go to national conferences. And that's an opportunity just to exchange dialogue, because there's just so much information out there, and you want to make sure you've got the right information to make the right decision. And how comfortable are you with your data offsite or offshore? This is really an easy one for us. You know, we are academic medical center embedded in the city of Chicago. We've got a great brand and a great relationship with the city. One thing we're not going to do is go offshore for anything, because that takes jobs away from the citizens of Chicagoland, and that's just not good business. We have to not only take care of patients, but we have a major effort to have philanthropic events, support events, not-for-profit stuff. We do a lot of community care. We do a lot of free things for colleges, other not-for-profits, and you know, we're embedded in the city of Chicago. We would never go off-site. We would not even consider it, simply because it hurts our partner, which would be the city of Chicago. And then finally, if you do have the bug for this, if you do have the itch, how could you sell this to your organization? Because you have to come up with compelling business reasons as to why this is a good move, and not just something that, you know, okay, well, here those IT folks go again. They're jumping to the latest technology and blah, blah, blah. But I think you'll see from the Rush experience there are some things you can hang your hat on in terms of bringing this to your organization. All right, so here's the slide I want to concentrate on, and it's really one journey. So there will be multiple journeys out there. Perhaps some of you have similar cloud experiences. Perhaps you have different ones. But this is the journey that I want to talk about as really kind of the operations, boots on the ground type of thing. So give you an example. We were looking at an ERP selection back in 2008. And we knew we needed a solution, but if you go on the rush.edu site, you'll see this nice butterfly tower that we built and that we moved into in 2012. So at the time, it just didn't make sense for us. It was $6 million upfront infrastructure costs, and it was infrastructure costs that we had to sync, even though we might not even be using the ERP application itself. We just had to have a base, and we had to have infrastructure built, the old model, if you will. And so we had competing capital costs with getting into the tower, and there was some hesitancy still about putting this in the cloud, going back to Larry Ellison, who made his quote in 2008. So we deferred the purchase simply because it wasn't right for us in terms of the other business imperatives that we had going on. So move to 2010, Gmail versus Outlook. We were on another email product that was not satisfactory for the organization. So it was really close between Gmail and Outlook. And the reason I call these two out is because they're two common platforms for email. And in reality, I think it's a toss-up between Gmail and Outlook. But again, it's dependent upon what your business is. So we had a very balanced presentation about email. But in the end, the outages that were occurring at Google, which were ill-timed for the time we were looking at this, were an unacceptable risk to the organization, as well as we have a lot of integration with Microsoft Exchange and Active Directory, as you guys probably do as well. So, excuse me. So it wasn't so much the brand name as it is the integration into your environment. And because of our commitment with Exchange and because our aversion to risk with Gmail in the cloud, those were really kind of the factors in putting in an email system rather than the capabilities of email as itself. So move to 2013 and our ERP selection. Well, by the time 2013 rolls around and you have 5 years since the beginning of our journey, we had another go at the EMR. I'm sorry, that should be ERP. So we have a significant upfront EMR cost as well. But typo on my part, my apologies. But we hosted the ERP in the cloud, and it was just because of the compelling ROI. So if you think about it, we did not have to make that infrastructure investment. We put it in the cloud, and we kind of go pay-for-go services. So if a particular model is in use and we need it, we could use that. And we didn't have to build unnecessary architecture to support applications or workflows that we were not going to use. So it was significant savings. And we saved a lot on the operational funds as well, because you got to think about cloud services not only in terms of infrastructure, but of licensing, of support, of data redundancy, failover, backup. So overall, 5 years, and 5 years really, it was just a significant ROI. And you'd be surprised how much of an ROI is so effective in kind of changing your mind at risk a little bit. Plus, I think the industry had matured a little bit more, so cloud computing was understood by the general population better than it was back in 2008. And then finally, we have a database that is kind of our information systems for the students. So students have a completely different application that they use for registration and class content, etc. We put that in the cloud. The vendor offered a cloud opportunity. We couldn't really have the expertise to service it here, so now we're moving that application into a cloud. And again, it's because it made sense. Made a lot of sense, both short-term and long-term. Health information exchanges, you're probably in the throes of that. If you're in a multi-system area, hospital system, or you're connecting with other hospitals even outside of your system, health information exchange is one of the pillars of the Affordable Care Act. And in fact, you do get money from the government if in fact you meet meaningful use 1 and 2 criteria. So again, that's going to be data that's in the cloud. So whether you're moving to the cloud or not, your data is already going to be there, simply because either by government mandate or return on investment, you're going to go forward with the health information exchange because that is government mandated, and you're just going to, that's something that, organizations really have to do. So wrapping it up, the ROI goes a long way. And again, these are technical decisions, but really I want to stress they're business decisions. So look for that return on investment with your cloud engagement. Privacy concerns are easing. You saw the quote from the CIA. Now, you really have to balance the CIA is not everybody, right? But there's still privacy concerns about cloud computing. There still are. And so far, we haven't had any incidents that we know of that have involved the cloud. But, you've seen the cleverness of hackers, and it's probably just a matter of time, if you will. Hopefully not, but there are still privacy concerns no matter what you're doing. Mobile devices are trending, obviously, whether it's iPad or tablets. And what we saw with our ERP, this is a really good option for new system implementations. Putting new stuff in the cloud is a whole lot easier than ripping stuff out of your organization and putting it in the cloud, especially one like healthcare, because we're 24/7. We just can't take systems offline. We have to have continuous 24/7, 365 coverage, because even a few minutes of downtime on floors can be very problematic. And viable disaster recovery option. We're starting to see this, I think, become more attractive. And again, simply because of the economics. Why would you invest in a hard storage approach, whether it's another data center on your campus or somewhere else? So again, the disaster recovery option might not be for everybody, but it might serve you well. So that is my last slide, and now I'll turn it over to Anthony.
Very good. Well, thank you very much, Jaime, and we look forward to our Q&A. With that, I'm going to turn it over to our sponsor, represented by Michael Leonard, Director of Product Management, Healthcare IT with Iron Mountain. Michael?
Thank you. Good afternoon, everybody. I'd really like to thank Jaime for his presentation and sharing his experiences regarding his journey to the cloud. I think we can certainly all learn from his advice today in his presentation. I'd also like to thank Health Systems CIO for putting today's webinar together. I think this is a really important topic, and I'm glad we were able to participate. I think Jaime's presentation showed us that it's not only possible, but it can be beneficial to an organization to evolve your IT strategy and infrastructure to support cloud-based services. I'd like to add a few additional comments based on our experiences in delivering cloud-based services. And specifically, we focus on backup and archiving and data center services. So when we speak with our customers, we start to look at how much a customer understands their current environment and their storage management strategy as it exists at that time. And we like to help customers think about backup, disaster recovery, and archiving as really distinct disciplines, and consider solutions that are really tailored to their specific needs based on their organization and the size, the scale of the organization. And then think about how frequently data might be accessed, the amount of data that's being stored, and their time frame for moving data from potentially short-term storage to long-term storage. And if you start to think about the backup space, when you have really tight RTO or RPO requirements with constantly changing structured data, you're really focusing on your backup and disaster recovery areas for protecting that data, because obviously this data needs to be available, accessible, and quickly recoverable in the event of any sort of disaster, whether man-made or natural. Because you need to recover that data quickly, it obviously has to be available and more or less at your fingertips. As you kind of start to move away from the backup paradigm and think more about the archival of long-term data or long-term storage, you're starting to deal with larger and larger data sets, right? So then you're starting to think about unstructured data, most likely managed by an application, but it's still unstructured data that's not going to change over time. And as we all see in healthcare, that data pool is growing exponentially in many cases. It's rarely accessed after the initial treatment period, and it has long-term retention requirements due to regulations, organizational policies, research requirements, and a whole host of other reasons. So it's really important to be able to develop a strategy that encompasses both sets of requirements, whether it's archiving or backup, and you can really think about it as overall data protection. What is the right way to treat specific sets of data over time, and how to either manage it long-term or be able to recover it in the event of any sort of disaster. But putting together a strategy that thinks about it from both points of view is really helping you come up with a more cost-effective and reliable solution across your organization and your infrastructure. And I have a build slide that I think I'll build pretty quickly so I can just speak to it. And so once we have a solid understanding of a customer's environment and their data and different data types, then we like to work to help segment that data to determine really how's the best way to protect it. One of the things we really try to promote is that backup and archiving are not the same thing, and they really need to be thought about differently as part of an overall data protection strategy. And in a pretty simplified way, typically databases and file shares, they're going to have frequently changing data, either in the databases or files that people are updating and changing on a regular basis, maybe spreadsheets or PowerPoints, things like that. And there's different ways to protect that data, and in many cases you can look at on-site or online media vaulting services to help with that backup and recovery situation. And then when you think about longer-term storage or large data repositories such as PACS or enterprise content management solutions, then you start to think about what's the best way to protect that in the long term. So kind of breaking down the different types of data in an organization and thinking about the right strategy to protect that data is really what some of these data protection decisions come down to. Much of this archival data does need to be accessed on a regular regular basis by clinicians early on in a patient's treatment cycle, or after an initial event that a patient might have. But then much of it is not going to be accessed frequently, if ever, but it still needs to be available. So you really need to consider how you can still provide fast enough access to that content while looking at managing that content over the long term. And there's a number of different ways to approach that. And so I wanted to add a few points to what Jaime had mentioned earlier when considering a cloud vendor. So from a provider's perspective, what are some of the things you should be asking about or thinking about as you engage with cloud vendors? Cloud providers are now bound by HIPAA in terms of being part of your. I guess the best way to say it is making sure that they're going to participate and have sign up for a BAA. So they become part of that chain, if you will. So you really want to understand where is the vendor in their understanding of that and their ability to commit to that. That's a really important aspect, and that really touches on the first two bullets there. Are they willing to sign up, and sign a business associate agreement? That's kind of table stakes in healthcare. If you're not able to do that, it's going to be a pretty quick conversation with somebody. And have you really taken a look at the vendor's history in terms of the services that they provide, the audits they go through, the certifications they might have for the services in the data centers, and how they deliver those services? Again, that should be a pretty easy question to ask somebody, if they're speaking to you about potentially using their services. And it's very important to consider encryption. Obviously security is really at the top of everybody's minds when we're talking about PHI, and really having a deep dive with the vendor in terms of how are they really protecting your data. Jaime mentioned it's your data. You're ultimately responsible for it. So you really want to dive into, and this is regardless of the type of application or service that's being delivered, you really want to understand how is the vendor protecting your patient's data and your organizational data. And then lastly, you really want to understand what is it that they're doing with the data once they have it. How are they storing it? How are they managing it? Where are they managing it? The cloud it's a data center, right, or a number of data centers. So you really do want to poke and prod at the providers to make sure you really understand how are they going to manage your data over the long term. On this next slide, I'm not going to go through the details, but I just wanted to point out, really the areas that Iron Mountain focuses on with our IT services business. And we break it down into three different areas: archiving services, backup services, and data center and IT services. Those are really the areas where we have established a very credible track record for helping organizations manage content for the long term or manage their infrastructure for the long term. Our data center business has been around actually quite a long time now, but it hasn't been something that we've shared publicly with a lot of organizations until the past year or so. That's the end of my advertisement, but I just wanted to make sure that everybody was aware of the services that we do provide. So with that, I'll turn it back over to Anthony.
Very good. Well, thank you, Michael. Appreciate your participation and sponsorship today. So with that, we have a few minutes for Q&A. So if anybody has any questions, please go ahead, send them into the Q&A box, and we will pose them to Jaime. But Jaime, let me start off by asking you, do you see any type of reduction in force, any type of that being an element of moving things into the cloud, the ability to reduce some staff that had been allocated to managing things in-house that will contribute to a cost savings in the long term?
Well, I guess, Anthony, that would depend upon the size of your organization. I think just about all of us are having to do more with less and wondering when that's going to stop. But I think particularly in healthcare, for those that are in healthcare IT, we're all in a pretty good spot right now because the population is aging and the baby boomers that contribute to Social Security will soon be the consumers. And the numbers behind baby boomers are less than the baby boomers. So there will be, as a matter of fact, there's a gap between the number of healthcare jobs that are going to be needed versus the number that we're going to be able to fill. So while I know that's in general terms, but I think more of the savings is more dramatic and more pronounced in the actual hardware and licensing costs versus personnel. And besides, if you have a good person that's working storage, they're usually got some other skills and other types of technologies, you can still use that employee for other areas, or like a half FTE or 1 or 2 FTEs. So I see some economics in ROI with cloud from a personnel perspective, but I think the bigger bang is with the actual capital and operational costs and the savings that you get from going to the cloud.
Very good. I'm going to read a comment from one of your CIO colleagues and just get your reaction. In addition to the points mentioned about, quote, what the vendor will do with the data, end quote, we need to know they will not blind our EMR data and sell it to others without explicit approval. What are your thoughts on that, Jamie?
Well, that goes in your contract, and a well-written contract that's reviewed by your legal department, will help enforce that and identify it up front. Certainly there are nefarious things that can happen with your data no matter what. That's why I would say go with a more established type of firm, and one that doesn't appear to be in it for the short term or the startup, and they may be very attractive and maybe giving you a good pricing, but you still have to do your homework. And perhaps the best homework I would offer for CIOs is try to find either through some social media type, what other experience CIOs have with company X or company Y. What's been their experience? So I think if you do your homework, and you're obviously going to have extensive legal review. I think if you do your homework along with that legal review, you should be on safe ground. But again, there are no guarantees in life, and there's no guarantee that something bad might happen through cloud computing, just like any other type of operation. But I think you go forward trying to mitigate the risk. But again, sounds like I'm hedging now, but that's a risk, and that's a risk that your organization has to determine: is that a credible risk? Is that a large risk? And how does that merge with our desire to change or our culture? Those are really important decisions to make.
Let's talk briefly about changing culture, and this may be our last question. It seems to me, would you say that IT folks are more comfortable with cloud issues or moving to the cloud because they understand it better, and that perhaps the folks that you need to help convince the rest of the C-suite, the board, and bring on board, if this in fact is your recommendation, they may be a little more wary because they've heard some negative things. How does that dynamic play out? And what can a CIO do? What type of messaging or education could a CIO do with those individuals in order to bring them on board and get them comfortable?
Well, you really have two different types of audiences here. And even your C-suite discussion might be different than the discussion you have with your risk manager. So you have to tailor whatever your supporting argument is to the audience. I would say that on the technical side, there's a lot of people that are excited about cloud computing, but one group of folks that's not excited about cloud computing is those that are data center operators. These are the ones taking out tapes. These are the ones that are monitoring equipment. These are the ones that, troubleshoot things that go offline. So you could try to sell the cloud to them all day long, but they fear that their job is going away. So what you have to do is hopefully you've got career plans and training plans to transition the good employees. I mean, a good employee is a good employee, and you want to keep those good employees, because once you have a good employee in this business, you really want to keep them close by. The C-suite is going to be another example. So the C-suite, you really got to concentrate on how valid is the cloud today? What is the return on investment? Is this a fit with our overall strategic goals? And then you have to be able to answer the hard questions, just like the hard question I got before. Well, what if somebody anonymizes our data, and what if our data gets stolen in the cloud? I mean, these are real concerns. So just like any decision that gets made in an academic medical center or other types of hospitals, it's still all about what works best for you. And if you have a C-suite that is perhaps maybe older people or people that just aren't technology savvy, probably going to be a pretty hard sell, because they'll just have a whole bunch of fear and apprehension. So, again, the cloud is a tool, and CIOs are trained to kind of look at what's the best opportunity out there for us to grow and for us to be more efficient. And sometimes, if it's not a right fit, then even the best laid plans to talk to the C-suite aren't going to bear fruit. So a lot of it depends on the culture of the organization, the ability to absorb particular risks. And quite frankly, if that is really strong, then cloud computing is probably not a good tool that your organization would use.
All right, very good. Well, that's about all we had time for today. I want to thank Jaime and thank Michael and Iron Mountain for sponsoring. You will receive an email when our archive is ready and a separate registration is required. If any of the folks on the line today hold the Chime CIO certification, we'll communicate that to them, that you've attended if you've asked us to. If not, please contact them yourself. Questions, comments, email me, and you can go to our website to view our upcoming schedule in the last 12 months of archived events. So again, I want to thank everyone for joining, and have a wonderful day. Thank you.